español. Um, just due to unforeseen circumstances, we regret to inform you that we will not be able to provide simultaneous Spanish interpretation during today's training. We apologize for any inconvenience this may cause, especially for our Spanish-speaking attendees. But please be assured that we're working to resolve this issue and expect to have Spanish interpretation available for our next training on June 27th. We appreciate your understanding and patience, and we remain committed to making our training sessions as accessible and inclusive as possible. And if you have any questions, please feel free to reach out to us. Thank you. Buenos días, participantes. Debido a circunstancias imprevistas, lamentamos informarles que no podremos ofrecer interpretación simultánea al español durante esta capacitación. Pedimos sinceras disculpas por cualquier inconveniente que esto pueda causar, especialmente a nuestros participantes de habla hispana. Queremos asegurarles que estamos trabajando activamente para resolver este problema y esperemos contar con interpretación al español en nuestra próxima capacitación el día 27 de junio. Agradecemos su comprensión y paciencia y seguimos comprometidos a que nuestras sesiones de capacitación sean lo más accesible e inclusiva posibles. Si tienen alguna pregunta o inquietud, no duden en comunicarse con nosotros. Gracias. Okay, and now to introductions. Good morning, everyone. My name is Bianca Gonzalez, and I'm the consultant working on the Behavioral Health Training Series for King County Health Department. Thank you for joining us today on Understanding Mental Health, where we're going to work to increase our understanding, reduce stigma, and gain practical tools for supporting mental health well-being. This training is part of our monthly training series that's presented by Kane County Health Department in support of a stronger behavioral health system in our community. We are very happy to have Vanessa Hernandez with us today. Vanessa is a bilingual licensed social worker and a certified alcohol and drug counselor with over a decade of experience. She supports adults, adolescents, and families. Specializing in trauma-informed care, Vanessa works with individuals facing PTSD, substance use, grief, infertility, and chronic pain. As an EMDR-trained clinician, San-Tre EMDR practitioner, and an intermediate-level somatic experiencing student, Vanessa integrates creative, body-based, and mindfulness techniques to help clients release trauma and restore balance. By guiding clients in identifying and releasing stored trauma, regulating their nervous systems, and creating ease in their bodies, Vanessa fosters long-lasting healing. With a culturally sensitive and client-centered approach, Vanessa is especially dedicated to Spanish-speaking communities, creating a safe, inclusive space for healing, resilience, and well-being. As a reminder, today's session is being recorded, and the recording will be available on our website. We'll take a break around halfway through, and CEUs will be available, and I'll post the link for that in the chat once we get started. And with that, I'll turn things over to Vanessa.
Good morning, everyone. Thank you for being here this morning. I truly appreciate your attendance. I'm happy to know, and I'm seeing a lot of colleagues. Thank you for being here. A lot of former colleagues, and community members and advocates. So today we're just going to spend a little bit of time exploring the concept, the stigma of understanding mental health. So let's just go ahead and start it, okay? If you have any questions or anything throughout the presentation, please do not hesitate and let me know. I'll be okay if we take a moment to pause, okay? Is that okay, Bianca, if I share my screen now? Okay.
Yes, please go ahead.
Okay. Let me just put Do you guys see the presentation? Yes, thank you. Okay, so let me see. Okay, so okay, so a little bit of some of the objectives that we have for today. Today is going to be a journey, pretty much. We're going to start together by building an understanding and the key components about mental health, the concept and framework. This will give us a solid foundation to recognize warning signs, support others, and prioritize our well-being. We will cover four main areas: understanding, recognition, support, and self-care. First, we will learn about pretty much the core mental health principles so we can have the right knowledge and context when we're working with individuals. Then we will focus on identifying when someone might be struggling so we can intervene early. Prevention is a key component. So understanding those warning signs and when to ask for help is going to be another component for this presentation. We will develop practical skills to effectively support others dealing with mental health challenges. Finally, we will discuss some strategies. Throughout the training, you're going to see me pausing for a moment and doing some quick exercises. And those exercises I pretty much tailor in a way that I use when I'm working with an individual and I see maybe some level of activation. And or maybe after a tough session, we will maybe use some exercises to bring individuals back into the window of tolerance. So exercises like that is what you're going to be explored today. And also the importance of self-care. As a clinician, as a practitioner, as an advocate or community member, it is important to take care of yourself. We set a powerful example for our clients when we begin taking care of our own self-care and transferring that to our clients. So some of the objectives that we have in here. Again, build knowledge, develop your skills. All of this is going to help you to create an action plan to apply everything that we're learning. So when you have a client in front of you and is struggling, we can be able to use some of those skills. Understanding the mental health concept, the common conditions, and the current approaches to support individuals. I'm going to look through these presentations through the lenses of trauma-informed, substance abuse, mental health, dual diagnosis. So if you see anything that is getting your attention, let me know, raise your hand. I'll be happy to answer. Action plans sometimes are tailored based on the population. So if you have an individual with dual diagnosis, might be a little bit different than you have for an action plan if you have an individual that only has a mental health disorder. Mental health is a complex and dynamic concept. It is not a fixed destination, but an ongoing process. It includes emotional, psychological, social well-being, and affects how we think, feel, and act. Mental illness, on the other hand, refers to a diagnostic condition, the impact of mood, thinking, and behavior, such as anxiety disorders or depression disorder. Mental health exists in a continuum and is influenced by a variety of biological, psychological, and environmental factors. Later on, we're going to explore ACEs. It is important to recognize that mental health is a fundamental part of our overall health and well-being. A little bit of a statistics. Do you know that 1 in 5 adults and 1 in 6 youth experience mental illness each year in the US? The impact of mental health conditions is far-reaching, affecting individuals' physical health and productivity, relationships, and even lifespans. Mental health conditions cause a global economy over 1 trillion in lost productivity each year, highlighting the urgent need to expand access to care, early intervention, and public awareness. This is exactly why we're doing the presentation that we're doing this morning, so we bring the public awareness. Despite the high prevalence, stigma, and systematic barriers present, all of this is still preventing us from seeking help. There's still individuals that are unable to break the stigma, and for that reason, they're not able to receive care. So let's just maybe explore for a moment what mental health disorders, some common and how affect many people. Let's overview maybe the most prevalent types of mental health conditions. We have anxiety disorder as the most common mental health condition in the United States, according to the Anxiety Depression Association of America in 2023. Anxiety involves excessive worry, fear, avoidance. Often the symptoms often interfere with daily life. Depression is more than just feeling sad. It is a serious mental health disorder that impact how a person thinks, feels, functions in daily life. While many people will experience sadness at some point, clinical presentation is marked by a persistent symptoms lasting for about 2 weeks. It can lead to significant impairment in relationships, work, school, and physical health. Fortunately, depression is highly treatable. We have that. We know that depression can be treatable with the support of medication management, the support of therapy, the support of community outreach, so peer support groups. We also have mood disorders. These mood disorders cause persistent changes in mood, including depression and bipolar disorder. Trauma-related disorders like PTSD can develop after exposure of traumatic events. It is important to recognize the signs and symptoms of this condition and seek professional help. There's a lot of stigma with PTSD. A lot of people believe that PTSD is something big, war, assault. PTSD goes beyond that. PTSD, it includes, and the work that I do, infertility, for example, a lot of individuals experience traumatic events during the process of infertility. So breaking that sort of a stigma, the PTSD doesn't have to be something big. It is important to recognize those symptoms and to seek professional help before it gets complex. Let's pay attention to those early signs and symptoms of mental health and the challenges that brings to individuals. This one includes physical changes, such as changes in sleep, appetite, or energy levels. It is important that we notice in our clients when we see a change and maybe how they're withdrawing socially from their peers or their friends. Maybe they're pulling away from their relatives. Maybe they're stopped doing those activities that they used to enjoy. Another symptom is the emotional shift. Sort of like we're noticing irritability a little bit more, feeling hopelessness. Maybe we notice a little bit of extra fear, anxiety. We begin noticing those intrusive thoughts. If you notice that your client is showing a decline on their functional abilities, that also is an indicator where someone has difficulty maybe performing their usual responsibilities at work or at school or home. Maybe they're not taking care of their pets anymore. Maybe we're noticing if you're doing a home visit and you're noticing that the house is not being kept anymore, that will be another sign that your client might be struggling. This is another symptom. It is important to be aware of these early warning signs. This is just early. This is at the beginning. And begin talking and having that conversation. Hey, do we need to seek out support? Is there anything that I can do for you? I'm noticing there is a struggle. Is that okay? Are you seeing the same thing? As a provider, it is important to remember the symptoms may look different across age, groups, genders, and cultural background. Early detection is one of the most powerful tools in preventing mental health conditions from worsening. So do not overlook. Take your time. Don't assume. Um, or just don't say, yep, I think it will get better next week. No, pause for a moment. Let's assess. And with that, I have this little acronym that I tend to use, assess. And this one, it gives me like about six steps for providing a compassionate support if I see that one of my clients is in distress. I used to do a lot of home visits back in the day. I used to be a doula also. So going to people's houses and being able to start assessing, is my client, it is in front of me, is it struggling? What is the kind of level of the stress? I want to first acknowledge the person's distress without any judgment. This helps them to feel better. This helps them to feel understood, heard. Someone is hearing me. Someone is noticing that I'm struggling. We want to slow down. It is important in regulating our own pace and tone to create a calming space. My client is already struggling. I don't also have to be activated. So checking in with yourself, slow down, it is important. Being present. This is something that sometimes we tend to make that mistake, right? We are having our sheet, our own little agenda. We're not paying attention. I'm not present with my client. So remain grounded and engage with a person, not getting distracted with the phone, not getting distracted with the emails, or maybe the next form that they have to fill it out. At that moment, we want to stay present with them. Explore with curiosity, not assumptions. I am curious about this. I am noticing this. Are you seeing the same thing? I'm wondering if you can tell me more about this. So don't assume, ask, am I wrong? Am I correct? Did I get it right? I'm noticing this sort of not engagement with others. Is that accurate? So asking those questions with curiosity rather than assuming. Seeing, as for seeing the whole picture, observing cues, the context, gives us a fuller perspective. Not just only what's happening in front of you, but maybe open your eyes a little bit more. Check in. What is behind the client? What is the client wearing? Are they on their PJs today? Do they sound or look like they brushed their teeth today? What is it that I'm noticing? So open your perspective. Seeing the whole picture is a key component. Finally, offer appropriate support to help them through this difficult moment. I often have my little resources list. I have this little QR codes that people can just grab right away for resources. So often in that resources, it is key. To know when to offer the resources is another important component that we want to be mindful of. Whenever you're ready to talk about this, please know that there are some resources for individuals that are struggling with PTSD, they're struggling with domestic violence, or they're struggling with depression. Please know that whenever you're ready, I'm here for you, and check in constantly. This structured approach has helped me to respond with empathy and care. That way my clients will know, hey, someone is hearing me. Someone knows my struggle. It is important to also take a look into the component of mental health in all areas of life, at work, at school, and our communities. So we're going to spend some time reviewing this. Mental health, for example, the mental health challenges at work is one of the leading causes of attendance and decrease of productivity in the workplace. Factors like stress, burned out, and work-life imbalance can create issues like depression, anxiety, disengagement among employees. The stigma around mental health often prevents employees from seeking help or openly discuss their concerns because they're so afraid that they might be targeted or they're so afraid they might be demoted. So supportive workplaces that promote psychological safety, clear communication, and flexibility can make a big difference. Offering those resources, those employee assistance programs, mental health days, maybe trauma-informed leadership training can also be implemented in a workplace, and that can reduce turnover and improve overall morale. um, Training supervisors to recognize signs of distress in their teams, foster a healthier, more productive work environment. So I'm a big fan of training, and it is important that even as a upper management supervisors to get that training to recognize mental health in the workplace. Mental health is a critical issue also at school. Something that we're seeing more and more, affecting students' ability to learn and thrive. Here we have 4 strategies to support students' mental health. Early identification, recognize those warning signs so we can intervene early. Supportive environment, create trauma-informed classrooms that promote well-being. This is an area that I often take a moment to work with parents. I tend to spend, if I'm working with an adolescent, I tend to spend a little bit of time of tell me a little bit about your classroom setting. Tell me a little bit about your school setting. As a provider, we want to have those dual relationships, either with a social worker at school or if they have maybe a counselor at school. We want to create that relationship. Of course, get an ROI for that. So we can have that communication between the therapist or the provider and the client and the person who is spending a lot of time with them. So what is trauma-informed care in a classroom? How is that included? How will that look like? That means predictable routines and a structure. Having that structure for students is a key component. Those visual schedules, those calming transitions, those passes that sometimes the students get, relationship focused discipline. One thing is having a restorative relationship, and another thing is having a punitive relationship. We want to build trust with the students. We don't want to build distrust. So those relationships have to have the foundation of how can I restore this relationship with my student? Use those regulation strategies, being able to, as a provider, being able to check in of yourself, and maybe I have to take a break, maybe I have to step back. Also, my students, do they need a mindfulness corner? Do they need to break as well? Those flexible responses are important to give emotional and support. Those open-ended questions to the students, those are key. Those check-ins, check in with your student. How are you today? I'm noticing your chart. Last week was down. I seen you today smiling. How are you feeling this morning? Also, as teachers, social workers, school social workers, counselors, it is important to practice self-awareness and regulate your own nervous system when you're working with individuals. Mental health, it is critical. So we want to spend some time with our students and at the school. So we cannot overlook that one. And I'm not sure if anyone has ever heard about ACEs. Anyone? Yes. Yes. This is something that I often use a lot if I'm working with a adolescent or a teen. It is important to spend some time to see Where is my student coming from? What story my student has? When we understand the child and what they have lived through, we can better support how they learn, how they connect, and how they heal. So the ACEs is a scale of 10 items. It's a screening tool. If you're familiar with that, the CDC, CASER, all of that, they supported the ACEs. It's a measure to exposure to traumatic experiences before the age of 18. There are three domains: abuse, neglect, household dysfunction. Those are the areas that the ACEs tend to explore and tend to see. If individuals have encountered some challenges in their life, you want to hear them. If you have an adolescent, a student, you want to hear that. You may want to offer the ACEs questionnaire and see what comes up out of that. This is a tool to guide us. This is not to label. This is not to diagnose. The ACEs score is just to give us an understanding, give us a little bit of an insight, or where our client or student maybe has experience. The higher the child's ACE score, the greater risk for mental health disorders, behavior challenges, learning difficulties, and chronic illness. ACEs can lead to toxic stress, which disrupts brain development, emotional regulation, and executive functional skills. Sometimes we see those children, and we may assume they don't care, but no, but it's not that they don't care.
Pero no es que no les
There's
importan.
something in there
Hay algo
that we want
dentro
to sort of
y
identify
que
and
queremos
better support.
identificar.
So again, assumption, we cannot assume. I'm gonna go back to that. If the student, the client, scores at ACEs between 0 to 3, that means that there is a lower risk, but still they might need support. 4 and up, if they have answered 4 questions and up, that means that there is increased risk for mental health, academic, and health challenges. For the ones that maybe are not familiar with ACEs, please know that it is available. Again, it's only 10 questions. And this is for individuals that have experienced adversity before the age of 18. Let's take a moment with this one. You don't have to answer. You can always, in the quietness of your heart, the silence of your mind, answer some of the ACEs questions. And this will give us maybe a little bit of understanding about your own mental health. So take a moment. Let's see. Did a parent or adult in a household often swear at you, insult you, or hurt you? Did a parent or an adult in the household often push, grab, slap, or throw something at you? Did an adult or someone at least 5 older than you ever touch you sexually or try to make you
Menos
touch
5
them?
años más grande que
Did you
usted que
feel
antes le
that no
tocaba
one in your family
sexualmente
loved you
o les
or
pedía
thought you were
tocar
important?
ellos?
Did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you? Were your parents ever separated or divorced? That is part of one of the ACE questions. Was your mother and stepmother often push, grab, slap, or had something thrown at her? Did you live with anyone who had a problem with drinking alcohol or used drugs? Was a household member depressed, mentally ill, or ever attempted suicide? Did a household member go to prison? You don't have to answer out loud. You can always answer in the quietness of your heart or your mind. But this to just give us a little bit of understanding where we at. This is why we're doing the presentation that we're doing today, because we want to bring education to the community. Community support is critical for prevention. Access to care and recovery when it comes to mental health is a key component. A school, religious institutes, libraries, and local organizations can serve as an important gateways to connect people with mental health resources. Every time that I go to the library with my kiddos, or if maybe I'm at a church or a school and I see the bulletin board with some sort of mental health awareness support group, or the next event in the community about that, that really sort of gets my attention. It's like, yes, we want to bring this information to the community. A stigma around mental health issues at the community level can delay people from seeking treatment and increase their suffering. Social pretty much social determinants of the health, like housing, education, income, have a big influence on overall mental health wellness. This is why it is important to have those peer-led support groups, community outreach, and cultural responsiveness. Public health campaigns like this one today sort of like help us to increase the knowledge, bring literacy to people, empowering the community, and to reduce the stigma and support one another. So here we have a little bit about recognizing those warning signs. Again, we are going to review them one more time, a little bit more in depth. Communication changes, like withdrawal from friends and families, sudden shift in how someone is communicating can be an early warning sign. I'm sort of like ghosting people. I'm not responding those text messages. I'm not engaging anymore. I used to have a contact with my family, in my group chat once a week. I'm not part of that anymore. We want to recognize how our clients' level of communication is sort of changing, and we're noticing a withdrawal from their loved ones or their peers. If there is an expected change in the routine or demeanor, known in their behavior, that can also indicate that there is a struggle. If we notice that there is an increase of substance abuse or other risk coping mechanisms, can be a red flag that someone is having a hard time managing their situation. If I'm noticing that we're increasing on the alcohol, if I notice that I'm doing other behaviors, gambling, pornography maybe, we want to be mindful of that change, of that risk, the increase of risk behaviors. If there is a decline in work or academic performance, can signal that someone is overwhelmed or is in distress. If I have an A student and then I'm noticing by mid-semester we're struggling, we're not making it, I'm not doing my homework, I'm not turning in my assignments, parents are coming in and telling me that, everything is zero because they haven't turned in any work, we want to have that conversation. What's going on, kiddo? You used to do well. What is happening? Those concerning statements, like expression of hopelessness or feeling trapped, should always be taken seriously as potential warning signs. At that moment, we want to use our assess. At that moment, we bring our assessor skill, because that means that there is a need and we want to rule out the need for help. Persistent symptoms lasting more than 2 weeks indicate a need for a professional help. If you're a loved one, if you have a family member and you're noticing the symptoms longer than 2 weeks, this is a time where we want to have that conversation with a loved one and said, let's look for help. Let's call our insurance and let's look for a provider. Let's go through the health department. Let's talk to our nutrition or PCP. Let's do something. If you're working with someone, maybe this is a time we may have that conversation of the benefits for a higher level of care. This is the moment where we want to explore, It sounds like what we have been doing at our patient level of care is not working. Let's explore. I think it will be a good idea to explore at outpatient level of care, at PHP level of care, at inpatient level of care. If the daily functioning is impacted by the emotional or mental health issues, seeking support can be beneficial. Safety concerns like thoughts of self-harm, suicide require immediate attention and professional intervention. We cannot do it alone. I need a group of people that can support us. So if I'm working with someone and I know that the provider is in my office, I will get in contact with a provider, with a psychiatrist. I always have available a resource sheet for my client for the nearest inpatient program, the nearest PHP program, so we can have those immediate interventions. When emotional distress starts to interfere the relationships, it is a sign that additional support might be in need. My loved one is expressing concern. My significant other is expressing concern. My parent, my mom, is expressing concern. That is a sign because family members are seeing something that we're not seeing. So it's always good to spend some time with our loved ones and say, tell me what you see. Share with me what else are you seeing at home that maybe I'm not seeing at the office. It is always recommended to have those open conversations with your client or your loved one. It is difficult, but we have to have those open conversations. If I have an individual that I'm working and might be in a pre-contemplation instead of change, I want to have those open conversations consistently so I can move through those stages of change and move into contemplation, preparation, and action. Because we are in an era of technology, I have these little QR codes printed with me all the time. I have them available. I can just say, hey, sounds like there is a need for support. Here's a crisis phone line, the 988, where you can text, where you can call. There will be someone available for you. So have the QR codes available. People can just take a picture and have it. You don't have to give them a worksheet. You don't have to give them nothing. They can just screenshot it and have it in their phone. Make sure they save it. If you as a therapist, a clinician, social worker, you're going for vacation, it's always good. Hey, I want to make sure I'm leaving you in good hands. There is my supervisor will be available for you if you are in need of support during my absence. Also, here's some resources. Please have this sheet that it will help you in case you need support when I'm not available. So it's always good to review with clients those crisis support lines, those information resources, SAMHSA. Anyone is familiar with the SAMHSA website, the SAMHSA locator? It is great. You can just put your zip code, search what is it that you're looking for, and SAMHSA will give you all the providers in your area that meet the requirements for the services that you're looking for. The PTSD support group, I actually use it a lot for my clients. They have a lot of webinars. They have group support, virtual support groups that people can attend. Sometimes they're for free. They have a lot of resources for individuals that have experienced PTSD. So that is something that I value a lot. Let's review the myths and the facts. Often people have misconceptions about mental illness, believing those affected are violent or weak. I hear that all the time. In reality, most individuals with mental health conditions are not violent. They're actually likely to be victims of violence. Mental illness is a medical condition, not a sign of weakness. It is influenced by genetics, environment, stress, not something that people can just snap out of it. So having those conversations with individuals about mental illness, it has to be part of your practice. We have to break the stigma that it is a weakness. It is something that we cannot talk about it because other than that, something bad will happen to you. So no, we have to have those conversations. Effective treatments like therapy, medication can help manage symptoms. The contrary of the myth is that they don't work. Actually, they do work. And with the right support, with the right mental health provider and the communication, the collaboration with your provider, it is possible for individuals to fulfill a healthy life. It is important that we address these myths and educate people about the facts around mental health. This will help us reduce the stigma and ensure those affected get the care and the support that they need. So reducing a stigma. Reducing a stigma around mental health is crucial for creating a more supportive and inclusive community. Sharing personal experience help us humanize mental health challenges and promote greater understanding among people. It is important that you talk with your clients about maybe the struggles that you have witnessed in your life in the past, the benefits of seeking for help. Having those open dialogues about mental health at home with your peers, as a part overall includes the cohesiveness of support. Community-driven initiatives like this one that increases acceptance and support for those facing mental health challenges are impactful. Providing accurate information and education helps fight the myths and the misconceptions about mental health. Together, know that together, we can actually break that stigma and create a more compassionate, understanding environment. Language is a key component. Language, how we talk, how we express, impact when we're working with clients, both in the positive and the negative. So we have to be very mindful of what we said around them, on the hallway. We have to be very mindful who is outside your door. Those terms like crazy, psycho, addicts, they're so hurtful. So hurtful. We should avoid completely those labels about people and their diagnosis. This is something that I tend to sometimes get very, very rigid with my thinking. I tend to use individuals with addiction. I hate or dislike a lot when I hear potheads, dope heads. No, we want to stay away from that. This is individual suffering and pain. So avoiding those labels and those misconceptions. Media also plays a big role, especially when we see or hear negative stereotypes. Someone yesterday, actually outside my office, says, "Oh, what is this place? Oh, it's a therapy place. We have, clinicians and doctors. Oh, you will not handle me. I'm so crazy." And I'm like, "Oh, here we go. Let me give you my little speech about that." No, there's no such a thing like crazy. There's wounds that we have to take care of. Instead, we should use those person first language that focus on the individual, not just their condition. For example, a person living with schizophrenia, a person living with anxiety, a person who is battling addiction. Accurate, balanced media representation and stories that humanize mental health experiences can help reduce the stigma and promote understanding. So we have some communication. Again, we overview it again. Let's explore those communication, open-ended question, active listening, empathic, be respectful with your boundaries, honor the person's limits and privacy, creating that environment and trust and safety. Remember that your clients are struggling with finding safety within themselves. So our environment has to be environment that can create trust and safety. Listening. Active listening is key. for building trust and understanding in any conversation. When someone is speaking to you, it is important to give them your full attention. We cannot be on the phone. We cannot be doing the biopsychosocial assessment. I understand that that is more work for us, but at that moment, we want to stay present with our clients, remove all distractions, having that eye contact with them means a lot. Trying to set aside any of those assumptions or judgment. Please be mindful with yourself before going into your session or before walking into someone else's house. Be mindful. Listen to your own self. As they speak, reflect back what you're hearing. Show that you're listening, that you're validating. Am I hearing correctly? This is right. Did I get it right? It sounds like you are frustrated with the situation. Um, Statements like that is what is gonna help individuals know that you're hearing them. Avoid the temptation to immediately trying to fix the problem. This is something that I tend to balance a lot. I used to do a lot of case management, and sometimes when I see the need, I want to help, and then I'm forgetting that, hey, maybe right now we don't have to fix the problem. Maybe I will take 5-10 minutes of my time later on and send those resources. At that moment, I want to stay present with my client. I don't have to fix their problem. I can actually help their container to be a little bit wider so they can support and they can hold their sensations or their struggles more than what they used to. Active listening and validation demonstrate empathy, and help the other person feel truly understood. As we're getting closer to our break, we are going to do a quick exercise. So I want to give everyone the heads up that we're going to be doing a 5-6 minute exercise for de-escalation techniques. Okay. De-escalation techniques: speak calmly, maintain distance, non-threatening posture. We can do that. Simple choices offer limited, clear options to restore control. I decided to use de-escalation as the resource for our presentation, and we're going to be using a somatic experience exercise for this one. So let's get ready for this one. Anyone familiar with somatic experience, just raise your hand. But the key component for the exercise is orienting to the environment, grounding through contact. Thank you, Taylor. Tracking sensations. This exercise is designed to help clients regulate their nervous system and manage difficulty states. Like if you notice that your client is maybe moving away from the window of tolerance. This exercise can be tailored to the individual's need and comfort level. So you're going to hear me saying, if that is okay with you, I will invite you to. So those are very we can just go with your level. It is not my exercise, it is your exercise. It is important to guide the client through the experiences slowly and with compassion. So as we move into our exercise, you are gonna do the same thing. We're gonna move slowly and with compassion for yourself. Okay? So let's get ready. Let's take a breath all together. Maybe 1 or 2. Get comfortable. Adjust yourself for a bit. Maybe step away from the screen. Look around. If you have a window, look outside. Yeah. And then this invitation is for you. If you want to close your eyes, you're more than welcome. If you want to turn off your camera, you're more than welcome. I want you to really embody this exercise the best way possible. So whatever works for you. Let's begin by gently taking a look around your room. Just notice where your eyes are drawn to. If there is anything that feels comfortable or familiar to you. Maybe things are neutral. You can slowly just Turn your head right and left. Check in with your breath as you do that. And just notice. Notice your body. Notice whether your body is beginning to settle. Yeah. Bring awareness to your body. Can you feel the support beneath you? Can you feel the ground? Can you feel your feet? The chair that is holding you up. Take a breath in and a breath out. And let your body soften just a bit. Notice where in your body you feel the most contact. Maybe it's your feet, maybe your hands, maybe the back, maybe your shoulders. Just allow the awareness to settle there for a moment. Track your sensations. Just notice that part that you feel maybe a little bit tense, maybe neutral. Yeah. Just notice how you go from one to another, being rested, calm, and activated again. Maybe a thought comes in. As you do that, notice what happens. Notice the changes in your breath, the warmth, the tingling, any sensation. Settle. Take a moment to just begin settling in as we close our exercise. And a breath in and a breath out. And again, feel the support underneath you. You're here in this moment. You're okay right now. You're safe. Maybe feel that that means for you. Maybe notice if there is a word or an image, maybe a body sensation that represents a sense of kindness, maybe a sense of okay that you can carry forward. If you have your eyes closed, just begin gentle. Begin opening little by little as you return to your space. Again, you can turn around, step away from your screen, see what's around you. Connect with your breath as your breath holds you. And if you're ready to go to your next task, allow yourself to go, knowing that you have connected with your present moment. Thank you all for this first part, the first hour. I hope you enjoy the exercise and the information. We're going to take a few minutes. Come back.
Vanessa,
Okay,
oh,
everyone.
there you
Thank,
go.
sorry.
No, that's okay. You were muted, and I just wanted to let you know.
Yeah, thank you. Are we ready to come back?
Yeah, we're ready.
Okay. Thank you, everyone. Any questions before we go to part two? I see in the chat a lot of conversations about ACEs, which is yes, it matters a lot. It is something that we want to be mindful as providers. Why not? Maybe talking to parents and bringing the questionnaire to their physicians. Yes, to begin building record. I've seen this dynamic among foster care parents working with their providers about this. So yeah. Somatic experience. It is a lot of grounding techniques, a lot of invitations for body awareness. And again, this is, for example, the exercise that we just did. I will probably do it at the beginning of session or
Al
maybe in the middle of
principio de
session.
la sesión o a la mitad de la sesión,
Excuse me? Oh,
disculpen,
the exercise that we just did, for example, I will do it at the beginning of session, maybe. If I've noticed that my client is coming in and is very upset, is very activated, we probably will use that exercise so we can begin working through the session. Maybe during session, maybe in the middle of session. And of course, you can use it always at the end of the session. Before I go to the next slide, let me just check if there is another question. Thank you, Sharon, for the support. Yeah. Love pets.
Can I make a quick announcement?
Yeah, of course.
We do now have Spanish language interpreters, so if anybody wants to listen to this training in Spanish, you can go ahead and click the interpretation button at the bottom.
Oh my gosh, that is so cool.
Si hay alguien que quiere escuchar esta presentación en español, favor de tocar el botón de interpretación abajo. Gracias.
Muchísimas gracias. Excelente. Yeah. Okay, so we're gonna move to culture, the role of culture. Culture plays a significant role in how mental health is understood and addressed. Cultural factors shape the way the symptoms are expressed and how individuals perceive and respond to mental health challenges. As a provider, social worker, school, you have to have that willingness to seek for help if you notice that even you yourself as a clinician or provider is struggling to understand the culture of your client. Supervision in that matter is a key component. Maybe I don't quite understand my client's cultural background. Maybe I can research. Maybe I can get a training about it. Maybe I can ask questions. We can never assume. So if you as a clinician, as a social worker, a case manager, you do not understand your client's cultural
si
background,
no entienden el antecedente cultural de su
have
cliente,
supervision, read about it, educate yourself in that component. Acceptable treatments are often determined by cultural context, which may include traditional or alternative healing practices. We have Western approaches and we have the Midwest approaches, the Eastern approaches. So we gotta be very mindful of that. There are some barriers of accessing quality of mental health care, and that includes language differences, limited availability of cultural informed providers, And often sometimes we think that culture in that sense does not matter. But if you have a client that is calling your office and is looking for a provider that can connect in a culture level, let's try to make all possible for that to happen. And if in the office there is no one available, maybe I have to begin creating a list of referral sources of therapists in the area, or maybe resources in the community of professionals with that cultural background. Cultural competency practices involve incorporating cultural healers, adapting interventions to cultural contexts, recognizing the strengths and resilience with diverse culture communities. Cultural backgrounds significantly influence beliefs about mental health and help-seeking behavior. It is important to recognize that this culture differences and be very sensitive to them in our own interactions. Using preferred terminology and offering translation services like right now, this moment, it just helps ensure clear and respectful communication. Alongside evidence-based approaches, we should also honor clients' cultural healing practices and traditions. You have to self-reflection. Take a moment to reflect for yourself, within yourself. We need to examine how our own biases and how they may impact how we interact with our clients from a diverse backgrounds. I have made those mistakes. I'm sure you have made those mistakes. It is okay to reflect, to sit for a moment after the session and reflect, oops, I made a mistake. I assume. Assumption sometimes, again, it goes against building trust and safety with your client. So we cannot assume that if I have a person who may look like certain racial background or cultural background might be that one. So we can't assume. We have to ask those questions, be curious about it. Mental health beliefs and attitudes can vary across cultures and communities. Some interpret emotional distress through a spiritual framework rather than medical models. Some don't believe in counseling, and they may want to seek support through their local church. It is important to avoid assumptions and understand what mental health means to each individual in the community. As a respectful starting point is to ask, what does mental health mean to you? What does mental health mean in your culture? What does mental health mean in your family? Asking those questions rather than assuming again. Younger generations like Gen Z tend to be more open about discussing mental health compared to older generations who may face increased stigma or avoidance. So I love working with the Gen Zs because they're all about, Instagram and TikTok and Vanessa, this is what I saw and look, this is very familiar to what you and I were talking about the other day. So I love working with the Gen Zs because they're more open. They tend to be more flexible with their thinking when dealing with mental health. The rise of digital technology has shaped how younger tech-savvy generations access mental health information and support. This is why I have created my little QR codes, because I know that my Janesies are not going to accept my little worksheet, and it will be much easier to Snapchat or take a picture of the QR code. So we gotta spend some time understanding that trauma takes many forms: acute, chronic, and complex. Acute trauma results from a single overwhelming event. Chronic trauma occurs repetitively over extended periods. Complex trauma involves multiple, varied traumatic experiences, often interpersonal. To know that trauma has a neurological impact affecting the brain structure, the stress response, and emotional regulation. Understanding these different types of trauma and their effects is crucial to provide appropriate support and treatment. As a provider, we want to spend some time understanding trauma, the kind of trauma, what a spectrum of trauma my client is facing. If we're talking about culture, how culture impacts trauma, how trauma impacts culture as well. So spending some time in this area. So when we seek for help, we can provide the right resources. And then as a provider, self-care is essential for professionals. And this is how we prevent burnout and maintain perspective. One thing that I often tend to use working with people is journaling at the end of my session. If I had a tough session, if I had a difficult one, or if I made a mistake, self-assessment can help us to reflect in our own experiences and emotions. And this sort of like give us a little bit of self-awareness and increase our flexibility with ourselves. Peer support through regulation consultation with colleagues, providers, other maybe group communities, peer support group communities, all of that can give us validation and opportunities to solve a problem or to maybe get a different feedback on how to work with a client that it might be in your mind. Collaborating with others who understand our challenges can be very valuable. I tend to do a lot of consultations. I tend to value consultations a lot. Every time that I go to consultations, I feel energetic, I feel grounded in my skills. That sort of like helps me to stay strong in the path that I'm using to be a better clinician. So peer consultations doesn't have to be talking about your clients and how awful the job is. It's not about that. It is about, hey, how can I better serve my client? What did you do? What resources are available? What skills maybe I can use? Maybe someone else may have a different skill, or maybe there's a new training in town that might be beneficial for my skills. Setting clear personal and professional boundaries is crucial for protecting our own emotional well-being and mental health. This involves scheduling regular breaks. I'm not good at that, but I try to do the best I can. For example, limiting work hours or saying no to certain requests. Maybe it is okay to close your calendar. Maybe it is okay to talk to your supervisor and let them know, hey, I am maxed out. I cannot take one more client anymore. It will be a good idea to maybe close my case for a bit. All of that setting boundaries can help you to sort of like keep yourself grounded in your own skills. Incorporating self-care practices into your routines can help you stay grounded, energized, and effective in our work. Something that I tend to do to sort of incorporate my own skills in my own mental health as a clinician is to just, if I had a tough week, I'm going to dedicate one of my yoga sessions to that specific session, to that specific client that maybe triggered or maybe got activated in me. And I'm just going to go to my mat, and my mat will hold all the stuff and I will leave it in the mat. So this is how I bring mindfulness into my own clinical approach for myself and how to stay, everyone talks about self-care, how to maintain self-care. So let's jump into mental health and substance abuse. Mental health and substance abuse, again, you're going to hear me dual diagnosis, and people may use co-occurring disorders. It is okay. Mental health and substance abuse often go hand in hand, and research consistently shows that addressing both conditions simultaneously leads to better outcomes. Co-occurring disorders are common. Individuals struggling with anxiety, depression, PTSD, unresolved trauma may turn to substance abuse to cope, while use in itself can intensify or exacerbate the mental health condition. Integrated care is essential. Providers who are trained in both mental health and substance abuse treatment are equipped to offer a compassionate, effective, and comprehensive support. This means recognizing the complex relationship between emotional pain and substance abuse, and avoiding fragmented care that addresses one issue while maybe overlooking the other. Trauma-informed assessment often explores both mental health history and substance abuse patterns. This is a key in developing an individualized and appropriate treatment plan. This includes understanding triggers, protective factors, cultural influences, and the client's readiness for change. Again, this trauma-informed assessment pretty much focus providing a better treatment so we can understand those triggers, protecting factors, cultural influences, and the readiness for change. We also have harm reduction approaches that play a key role. I value harm reduction. That will be meeting people where they at. It is not about my agenda and staying sober in 30 days. No, it's about meeting my client where they're at without any judgment, sort of honoring autonomy and building trust, whether someone is ready for full abstinence or maybe to explore the idea of change. Harm reduction strategies create a safer foundation for healing and long-term recovery. I have seen it. Back in the day, it was a abstinence-based practice. You actually will go and you sign the contract of abstinence. Now we don't do that. Now is, where is my client? What state of change is my client in at this moment? Is my client ready for change? Do we have to explore the benefits of stop using or stop drinking? Meeting your client where you're at. Ultimately, recovery, it is not a one-size-fits-all process. It requires flexibility, empathy, and a holistic understanding of the person's mental health, physical and relationship well-being. So some treatment interventions that I tend to use when working with dual diagnosis. We have, the DBT components, which targets emotional regulation, urges, cravings. We also have seeking safety for individuals that have a history of trauma and substance abuse. Seeking safety is an evidence-based model. I'm a firm believer in value psychoeducation, spending some time with clients and their families, talking about the impact of substance abuse on the brain, body, how it impacts the trauma, how it impacts the relapse cycles, how it impacts the family system. This is the moment where we want to explore about those dysfunctional family roles and begin breaking the stigma about that, it is the person's need for change, but also it is the component for the family. So we want to integrate family. It is essential that when we work with an individual in substance abuse, we integrate their family systems into their therapeutic plan. We also use if we have skills and we have space and this is something that maybe the client is ready, maybe we can use other therapeutic components such as IFS model, internal family system model. We may use somatic experience, as we know that Peter Levine talks about how addiction is often an attempt to regulate a nervous system that has been dysregulated for trauma. So again, the trauma-informed concept comes into place. Because I have training in EMDR, I have tailored my EMDR training with detour protocol. I'm not sure if anyone is familiar with that, but EMDR detour protocol is a substance abuse protocol. And this one, it again is a skill, long-term training for this. But the main core focus of EMDR detour protocol is to build a stabilization, create internal safety, process those blocks or defense mechanisms, or maybe those protective parts that are not allowing the individual to find fulfillment, address limiting beliefs or unresolved ego states, and to develop the capacity to support, the capacity to resource within themselves, the capacity to have containment within themselves. We want to help individuals build those skills, those relapse prevention skills. This is an opportunity at early stages of treatment where you want to build this stress tolerance, emotional regulation, mindfulness, somatic experience, that exercise that we just did. Maybe in a group setting, there can be you can do this exercise in a group setting before the session begins, before the 3-hour begin, as a way of ground the group so the group can welcome the education that is coming their way. Relapse prevention plan, it is again essential to teach clients to cope with their triggers, to find support when they need to find other alternatives that maybe they will be beneficial for. This is when we want to integrate those support groups. This is what we want to bring into their lives: a smart recovery dharma, trauma-informed groups. Encourage peer support. It is essential. Effective care includes the flexibility. Substance abuse tend to be very isolated. So we want to connect individuals with resources in the community. Maybe with a sponsorship, maybe we want to church. So building that ongoing support and community and integration is key for individuals in recovery. Let's go with talk a little bit about youth and mental health. We want to spend some time talking how critical it is to bring mental health into youth. As the brain develops and continues into the mid-20s, 27s, we identify the formation, right? That can significantly impact how challenges are presented. It is important that we integrate our family. So family dynamics plays a crucial role. So it is important to understand the broader context when supporting young people. Warning signs to look out include those academic decline, changes in the friend group, interest, maybe at increased risk of taking behaviors. All of that is sort of like the warning signs when working with young people. Effective support strategies involve those open and non-judgmental communication, setting consistent boundaries and expectations, and seeking professional help and intervention when needed. By understanding the development consideration and being attuned to the potential warning signs, we can improve the right kind of support to help young people navigate the important stages of life. It is not about now you're an adult, figure it out on your own. We still need to provide that guidance. We still need to provide the support. If you're working with young people or maybe, young adults. So let's spend time with grief. Yeah, anyone familiar with the stages of grief, the 5 stages of grief? The 5 stages of grief offer a helpful lens for understanding how individuals may respond to the loss. These stages are not linear, and people may move between them in different ways and in different times as well. So I just want you to know that people can jump from one stage to the other. Denial, this can be happening. This is not happening to me. A protective response marked by a shock belief or emotional numbness. The mind shields itself from overwhelming reality of loss. The individual in this stage is unable to accept of what happened. Then we have stage 2, anger. Why this is happening to me? I can't believe that. Anger might be directed towards others or oneself or even the person who's gone. It is natural reaction to the sense of injustice and helplessness. It's very frustrating for the individual to accept the loss. So this is when they tend to either get angry at others, at the doctor, at the driver, or maybe at the individual itself. Bargaining. If only I had maybe done. Very common, very sad phrases. This stage involves attempt to undo or negotiate the loss, often with unrealistic thoughts of what is rooted in guilt, regret, or maybe despair. Then we have depression. Depression, as a reality settles in, a deep sense of sadness, emptiness, and withdrawal may take over. This is a time of emotional processing and more. This hurts so much. Individuals are just in pain on a daily basis. Acceptance, it still hurts, but I can move forward. We're starting to see a little bit of the light. Acceptance doesn't mean forgetting. It means learning to live with the loss, finding a new meaning, and integrating the experiences into one's life's story. When I work with individuals that are experiencing loss, it is important to help them consistently. Let's find a new meaning of life with a loss. What would be that? So sort of we help individuals throughout this journey. And there will be moments that may come back, and then we will help them then. So grief is very personal. Individuals may revisit the stages, skip one altogether, or express them in different senses, different dynamics. Also, we have to be very mindful of how individuals manage loss or grief based on their cultural background, personality, trauma history, and support system. And as we talk about grief, we cannot skip suicide prevention. According to the CDC in 2023, over 4,900 people die by suicide in the US. That's a death every 11 minutes. Suicide is a serious public health issue that affects many people. As a community, we need to be aware of the warning signs and know how to respond effectively. So let's spend some time with this one. The first step is to recognize the warning signs. This is why throughout the training, we have spent a lot of time in warning signs, because we have to recognize them. This, again, let's review them, include withdrawal from friends or activities, changes in their moods, giving away possessions, or maybe talking about death. If you notice the signs in someone, it is important to ask them directly if they are thinking about suicide. This does not increase the risk, so don't be afraid. In fact, it shows that you care and that you connect, that you are listening to them. It also shows that you are willing to help them and support them. So this is the moment where we want to connect them with resources. Once you have identified someone who might be suicidal, it is crucial to keep them safe by reducing their access to lethal means, like firearms or medication, or not leaving them alone for a long period of time. This is when we do those wellness checks in. And then finally, connect the person to professional help immediately. This is why, again, we have this little cards handy, the 988 suicide line, available by text or phone. It's 24/7. It's a confidential support, training staff available for individuals. Let's talk about burned out and compassion fatigue. And those two are very different but related challenges that healthcare professionals can face. So burned out is the result of chronic workplace stress, often linked to workload and lack of resources, and that builds gradually over time. Compassion fatigue, on the other hand, is the result of exposure to others' trauma, which can emerge suddenly after intense cases. So, I'm very grateful that I have an office that often checks on me, because I'm one of the clinicians that often tends to have the most complex cases. So this is when we want to maybe have a break, or if you're noticing that you have maybe 2-3 clients in a row that the main treatment goal is managing their grief and loss or suicide, you may want to put a break in between in there. You may want to also check in with yourself consistently, being grounded on the floor, your chair. If you notice some level of activation, this is the time where maybe you do have to do something at the end of your week. Maybe you might want to go for a walk, or maybe you may want to do some forest therapy walks, or maybe a yoga session, or maybe a massage. It is important to understand the difference between these two conditions in order to address them effectively and prevent their negative impacts on healthcare providers, such as yourself. So you need to understand burned out and compassion fatigue. The difference, what can I do when I notice the symptoms? Is there something else that I might be beneficial? Maybe a consultation, maybe a group consultation, maybe I need to speak with my supervisor. So I think Bianca, I think that the health department has the training for first aid, right? For the mental health first aid, if I'm getting correctly.
Yes, they do.
Yes. Good to know. Yes. I don't know if you guys are familiar with the mental health first aid training. It is a program that teaches people how to recognize and respond to someone experiencing a mental health crisis. So if you're a loved one that you have if you're a loved one that you have a relative that has struggles with mental illness, this training might be beneficial for you. It has great information to assess, listen, give support, encourage help, and promote recovery. So that is available for the community and for professionals in the mental health field. I believe I took this training like maybe in 2010 when I was in undergrad program. So great information, great information. So again, we're gonna mind-body connection interventions. We're gonna continue to just maybe we're gonna do an exercise in a little bit about this, but the mind and body are deeply connected. And there are practices that can help cultivate this connection for improved well-being. So everyone talks about breath work and breathing, but there is actually an art about breath work. A conscious breathing can reduce and activate the parasympathetic nervous system. So you may notice a bit of calmness and energy. Movement therapy, programs like yoga nidra, tai chi, integrate mind-body awareness. All of this promote healing. Like, why body work is essential in trauma healing? Why we keep talking about this? Dr. Benzel, talks about that the body remembers what the mind forgets. So trauma experiences, they just don't stay in thoughts in the brain. It actually stores in the nervous system. They store it in your body. They come up through your body. And this is why we notice the symptoms that we notice. It's the physiological symptoms that we notice. Even when memories fade, the physiological imprint of trauma can remain. So muscle tension, shallow breathing, hypervigilance, numbness, chronic pain. This is why I decided to, embrace the path of somatic experience student, because somatic experience help clients track physical sensations and release a stuck that everyone that the client says, I just feel stuck there. It's because the trauma responses are there. They have not moved through. So we have the fight, flight, or freeze response. These practices can also support an overall health and wellness by strengthening the mind and body connection. When I work with individuals, whether it is in private practice, in group, or when I used to do inpatient, this is the framework that I tend to pay attention. Where is my client at this moment? Is my client in a fight, flight, or freeze response? What will my client will benefit from? If I'm in the freeze response, then I might want to encourage movement. I may want to send a signal of movement. If I'm doing telehealth, you may see me moving my chair from one to another. I will say, let's get up maybe for a moment and do some stretches if I'm noticing that. So you as a clinician, you may want to explore that concept of where is my client at this moment. We're gonna do, let's just do a quick exercise. I wanna give you another exercise that you can do, the felt sounds exercise. This is not gonna be long, 3 to 5 minutes, so we're good with time. But yeah, let's first step away from the screen or from your phone or from your notes or from your computer. Let's just take a moment, step away from that. And this exercise, you can do it again at the beginning of your session, maybe the middle, maybe if you notice that your client is going into the dorsal vagal. This is gonna help the individual sort of like find grounding. So begin finding your space, whatever comfortable it is for you. Either sitting upright or relax. If you feel safe to do so, you can always close your eyes or gaze down. Begin orienting. Take a moment to notice the space around you. Let your eyes be aware of what is around in the room. Notice what it feels. Maybe pleasant or unpleasant. And if you notice some thoughts of the many little things that you have to do, allow them to go by. Let them pass. Bring attention inside your body. Gentle scan from head to toe, noticing any areas that may feel tight, heavy, calm, or neutral. Without any judgment, just be curious. If you notice your breath beginning to settle, acknowledge that. Now allow yourself to notice a place in your body that feels okay enough. Maybe not perfect, but settled, stable, neutral. Maybe slightly pleasant. This may be a sense of warmth in your hands, a weight on your body, on the chair, or maybe the rhythm of your breath. Stay with sensations and your breaths that come in. Notice the quality, notice the space. What happens when you place your attention there? See if it shifts, or maybe stay steady. Begin noticing if a word or an image comes to your mind that describes the sensation. Like calm, steady, grounded, bright for me. Maybe a color, a shape. Just simple acknowledge. Just gentle return to the room. Whenever you're ready, bring awareness back to your space around you. Maybe you wiggle your toes. Maybe you stretch your legs. Maybe begin opening your eyes. Yeah. Take a moment to notice how you feel compared to a few minutes ago. This small check-in can help us build capacity to stay present and regulate our nervous system. Whenever you're ready, let's come back. We have a few more slides to go. Yeah. Again, you can do this exercise. If you're noticing your clients' trauma responses, if you're noticing any response in the nervous system, maybe you're noticing the hypoarousal response again, this exercise can help individuals to just ground for a bit, help them put on pause all those thoughts or those sensations and just connect with their body in a more kind and a more grounding approach. Okay. We're going to go to the role of peer support. Peer support groups provide a powerful component to clinicians' care. This is something that we value in our community. We know that 76% of participants reported a greater optimism about the recovery after engaging with peer support. 62 of participants felt less isolated and alone with their condition after joining a peer support group. Peer support group has also been shown to reduce hospital admissions by 50% among participants. The unique insight and empathy or peer support can make a meaningful difference in individuals' mental health journey. Emphasize how peer support fosters a sense of community, reduces feelings of isolation, and really increases hope that they're doing something good, that they're giving back, all of which is very crucial for successful recovery. As we're getting close to the end of our presentation, it is important to check in with self-stigma and internalize the shame that can deeply be painful and to help sort of like doesn't give us a purpose, doesn't serve anything. It is important to first become aware of that your own negative beliefs. We have internalized about ourselves so much that sometimes we create negative beliefs. Practicing self-compassion, treating ourselves with kindness and understanding can help those harmful, intrusive thoughts. Connecting with supportive community. Those again, let's bring up those support groups, let's bring up church, let's bring up the hospital. That way we reduce feelings of isolation. Then this is maybe some ways that we can do to break this stigma. Mental health stigma is a significant barrier for people seeking the support that they need. It is important that we all do our parts to challenge this stigma. This is why you're here today, which I appreciate, and I'm so thankful that you're doing this. Because this is the part that this is our job. First, we can speak when we hear stigmatized language or misconception about mental health. Gently correcting people that this can make a big difference. It is okay to challenge people. It is okay to interrupt and correct. We can also educate others by sharing accurate information about mental health conditions. This helps reduce misunderstandings. Offering the same compassion and support for mental health challenges as we would for physical health, it is crucial. A small act of kindness can go a long way. And finally, we can advocate for policies that improve mental health access and equality for service. Each of us has a role to play in creating a more understanding, supportive environment for those facing mental health challenges. So let's work together and do our parts. Of course, we cannot go without putting such an emphasis to the strong component of policy and advocacy. This matters. The efforts that we do strengthens our health policies. And as we move forward and in a supportive collective way, let's review the key points. Practice compassion, continue learning, build connection, sustain change. Your advocacy plants seeds that are the seeds that will grow for generations. So what you do today is what is going to help the generations that are coming. This is why we are role models for our interns. We cannot teach them non-clinical approaches. We have to be very mindful of our behaviors and how we work and how we function in this setting, which is very complex. So be mindful of that. And let's just reflect a few moments. Let's just take a few seconds to reflect individually in the following questions. If there is new understanding, how would you apply this concept in your role? What barriers may you face as you implement this approach of breaking the stigma for mental health? What specific actions would you take after this training? How will you change after this training? What is the clinician in you that is going to be challenging now? After you reflect, maybe write it down, maybe put it in your journal, and start maybe thinking of some actions, some steps that you may take for change. So some closing thoughts. First of all, thank you all for being here today and for learning into conversation that so many still shy away from. Mental health, again, is not a weakness. It is not a personal failure. It is a part of being human. And yet, stigma continues to silence people, delay care, and deepen suffering. Breaking the stigma starts with us, with how we talk about mental health and in our own clinical work, in our jobs, in our space, in our families, schools, communities. It starts with listening without judgment. I emphasize a lot about that, normalizing support and showing that healing is not only possible, it is expected, and people do deserve that. Every time that we speak openly about mental health, we make it easier for someone else to ask for help. So every time we choose compassion over shame, we become part of the change. The stigma around mental health ends when we replace silence with understanding and shame with empathy. Let's carry this message forward with courage and kindness and share commitment to making mental health support accessible, inclusive, and free non-judgment and free from judgment. Thank you all for your work, everything that you do, and for being part of this presentation, for being part of this training. I hope that you can take something today and you can make a step forward in your future. I have a few minutes for anyone who has any questions or any comments or anything.